Hello, everyone, and welcome. I'm so glad you could join us today for our office hours webinar. We'll give everyone a few moments to join before we get started. So for now, please let us know in the chat where you're from, and then I'll share a few quick housekeeping notes to make sure everything runs smoothly. So I'm from Portland, Oregon, and it's a beautiful 70 degrees here today. Tell us where you're from. All right, without further ado, I'm going to share a few quick housekeeping notes. Feel free to use the chat or the Q&A box anytime to ask your questions. We'll have a few dedicated Q&A session at the end to answer your questions too. And if we don't get to your question live, you can always reach out to us at info@neurahealth.co and we'll follow up. We're also going to be sharing a special offer at the end of our time together, so make sure to stick around for that. Most importantly, please sit back and relax and enjoy. We're here to make this as informative and helpful as possible. Before we dive in, I'd love to quickly introduce a few key members of our Neura Health family. Whitney, our head of marketing, who's our super glitter glue that holds our team together, is driving our presentation today and help make our office hours webinar possible. Shruti, our content manager, is here, and she'll answer your questions in the chat and the Q&A. And my name is Kelly. I'm from the membership advisory team, and I'm here to guide you through what you can expect after you sign up as a Neura patient. We're all excited to support you and help get you the most out of your Neura Health experience. So let's begin. Today, we'll cover how does booking a video visit work? What is the intake process like? What exactly happens during a 45-minute video visit featuring Trevor Wright, one of our neurology nurse practitioners? And we're going to look at the role of your Care Concierge. All right, let's get started. One of the most commonly asked questions that we get in the membership advisory team is, how does booking a video visit work? Booking your video visit at Neura Health is just like making a reservation on your favorite dining app. You get access to your provider's calendar and pick the date and time that works best with your schedule. It's simple and flexible. No waiting on hold and no confusing steps. Now we'll take a look at a helpful tutorial to see how booking a video visit at Neura Health works.
How to book a video appointment with a Neura Health provider. You can book a visit through your Neura Health dashboard on the app or website. You can choose to verify your insurance at this step and wait to book, or proceed without insurance to view list of providers and availability. If you have verified insurance, you should see a list of in-network providers first, and then out-of-network providers. You can view their bios to inform your decision or ask your care team for a recommendation. Once you've picked a provider, click on Book next to their name. This takes you to their schedules for initial visit. As you can see, our availability is a few days. Pick a slot that works best for you. Fill out the form. Read the terms and conditions before you confirm your appointment. You now have the confirmation along with the Zoom link, ability to add to your calendar, and reschedule or cancel. Don't worry if you haven't saved this. You can still access it from your dashboard at the time of your appointment.
All right, thanks, Whitney. All right, so once your video visit is booked, we'll ask you to complete a few required intake forms. Now, this step is really important because it gives your care team a clear picture of your health history and your current symptoms. Completing your intake forms ahead of time means your visit can be more focused and personalized. Our goal is to ensure that your care feels seamless, thoughtful, and tailored just for you. Now we'll take a look at a video that explains the intake process.
How to fill out your Neura Health intake forms. Your intake forms give your provider important details about your condition and medical history before your visit. We strongly recommend using a laptop or tablet to complete them. Forms aren't saved if you exit midway, and larger screens make it easier to fill everything out accurately. To get started, go to the My Forms on the Neura Health dashboard menu, or visit app.neurahealth.co/forms. Click each form to open a secure link, and make sure to complete all forms at least 24 hours before your visit. If you'd like to send over medical records, email your care team at support@neurahealth.co for guidance.
Awesome. Now that we've seen how important it is to complete your intake forms before your visit, let's take a moment to talk about verifying your health insurance when it's applicable. Verifying your health insurance ahead of time helps confirm your coverage, clarify any copays, and out-of-pocket costs. This next video will guide you through the simple process of checking your insurance details and understanding any costs you might be responsible for. Verifying your insurance ahead of time helps make sure your appointments go smoothly, get you matched with the right specialist, and get you the best care possible.
How to get your insurance verified as a Neura Health member. To verify your insurance, select My Forms from the menu on your Neura Health dashboard or visit app.neurahealth.co/forms. Click the Insurance Form button to open a secure link. Carefully select your plan, enter your member ID, and hit Submit. You'll get an email from your care team once your benefits are verified. After that, you can go ahead and book your visit. If you don't see the form, it likely means we're not in network. You can still pay out of pocket and request a super bill to submit to your insurance for possible reimbursement. If you're unsure, just message your care team through the Neura Health app or email us at support@neurahealth.co.
All right, your visit is booked, your intake forms are completed, and you've taken steps to verify your insurance. So, what actually happens during your initial 45-minute video visit? Let's hear from Trevor Wright, one of our experienced neurology nurse practitioners, who will guide you through the process of your 45-minute initial visit. Hey everyone, one of the most frequently asked questions the membership team gets is, what actually happens during the initial visit? Even better, we get asked, how can a neurology appointment even work virtually? I'm excited to be joined today by Trevor Wright, one of our experienced providers here at Neura Health. Trevor brings a compassionate and thoughtful approach to care, and he's here to walk us through what you can expect during your visit and beyond. Trevor, welcome. We're so happy to have you here. Tell us a little bit about yourself.
Hi, Kelly. I'm really excited to be here. So, a little bit more about me. I've been working in neurology as a nurse practitioner for the last 10 years or so. And over that time, I've had a chance to help patients with a wide variety of conditions, from things like headache disorders, including migraine, to other neurologic conditions like epilepsy and memory loss. What I love most about this work is helping people find answers and helping them to achieve a better quality of life by feeling better and doing the things that they love. And just so we're clear, a neurologist is a medical professional who specializes in conditions that affect the brain, spine, and nervous system. That can include things like dizziness, pins and needles, cognitive changes, and of course, chronic pain disorders like migraine. We look at patterns, mental status such as cognition, symptoms, test results, and we work collaboratively with the patient to figure out what's going on and to set up an effective treatment plan.
For someone who's just signed up at Neura Health and is preparing for their first 45-minute appointment, what can they expect?
We really use that time to get to know the patient as a whole person. If able, we also like to hear from friends, family, and caregivers because everyone brings a valuable experience to the table. We talk through symptoms, medical history, any prior diagnoses or treatment, and just as importantly, how these symptoms are impacting someone's quality of life. We also conduct a virtual neurology assessment, which allows us to physically evaluate what's going on. It's not rushed. We want patients to feel that they're truly being heard and that their concerns are valid.
That's such an important distinction, being heard. So can you give a high-level explanation of what a neurological exam looks like in a virtual setting?
A virtual neuro exam focuses on observation and interaction. We might ask patients to complete standardized cognitive assessments, perform simple movements such as standing or walking in a line, to describe their sensations to us or to respond to prompts that help us to evaluate things like their coordination, their speech, memory, and strength. These evaluations are approved by the American Academy of Neurology and are very thorough. We are trained to pick up on small, subtle signs that help us to determine what's going on neurologically, and this exam is an important component of that.
Once you've done the exam and gathered the patient's health history, how do you approach creating the care plan?
We create a care plan with the patient, not just for them. That might include recommendations for lifestyle changes, medications, follow up testing, or referrals. We also work with our support staff, our care concierge, and our coaching team at Neura to provide ongoing support. The plan is always personalized and it evolves over time as we learn more about the patient and their needs. The most important thing to know is that you don't have to wait until things are bad enough to seek support. Neurologic symptoms can be confusing or easy to dismiss, especially when they come and go. But starting care early can make a big difference, not just in how you feel, but in how well we can treat and manage what's going on. Whether you're dealing with something new, something ongoing, or you're just not sure where to start, we're here to help to make sense of it all. We don't need you to have it all figured out before reaching out. That's what we're here for, every step of the way.
Awesome. Thank you so much, Trevor. That was incredibly helpful and reassuring. To everyone that's watching, if you're ready to take the next step, you can book your first visit at www.neurahealth.co. And if you still have questions, feel free to drop them into the chat and the Q&A, and we'll do our very best to get them answered. Amazing. All right. So now that you know what to expect during your 45-minute video visit, let's take a moment to talk about your care concierge, who will be right by your side throughout your entire Neura Health care journey. Your care concierge is available to answer your questions, help with scheduling and refill requests, remind you of appointments, field questions to your provider, and connect you with the right resources and referrals when you need them. No question is too small. Your care concierge is your go-to for making sure your patient experience at Neura Health is smooth, supportive, and focused on your care. And Neura's unlimited chat feature makes it easy to connect with your care concierge. Thanks again, everyone, for being here today. We truly appreciate your time. All right, my question to you is, are you ready to get started as a Neura Health patient? We'll open the floor for your questions in just a moment, but don't forget our special offer for attending today. Email us at info@neurahealth.co to get a secret code for 5 weeks of Neura Health membership for just $1. Remember, every step you take towards your health matters, and we're honored to be a part of your journey to better neurological well-being. All right, let's open up the Q&A in the chat. Who's got some questions?
Kelly, I know one question that often comes up, since we haven't heard any yet. One question that often comes up is, how often are you adding new insurance plans? Because, we only take certain plans in certain states, and part of that is because, all of our providers are subspecialized, and therefore the care team that you see for headache is a different set of people than the care team you would see for epilepsy, or a different set of people than the care team you would see for, undiagnosed symptoms. And so oftentimes the insurance is in network for one of those conditions in certain states and out of network for another. Can you talk to us about how often we're adding plans? Because it's pretty often, right?
Constantly. We work very hard every day to make sure that we can get in network with as many plans as possible. And a couple things to note, we now have a dedicated chat line where you can send images of the front and back of your insurance cards so that we can help determine if you have verifiable coverage. Even if you're out of network with Neura Health, I want to impress upon everyone that's watching. If we determine that you're out of network with Neura Health, all your other care will be in network, your referrals and your prescriptions. So if you want to get seen right away, you can even pay cash price for that first appointment. We'll give you that super bill, but then your care concierge will make sure that they work in network with the rest of your treatment. But we're always trying to get in with plans every day, and we always encourage you to reach out to us. We have some forms that you can fill out, and if you are out of network, we'll alert you when your plan does become in network.
Kelly, our
Good.
next question is, am I able to continue receiving Botox for migraine from my current neurology office if I use your services?
That's a great question. We get a lot of requests for Botox. So how that works is, obviously, as a virtual neurology clinic, we can't bring you to us for the injections. What you can do is work with your care concierge. You can recommend the facility where you're currently getting those injections. We can work with you to facilitate those appointments. We can work in network with your insurance. Anytime you need to step outside of Neura, your care concierge is your ally, and they're going to work with you to make sure that we are facilitating those referrals in network with your insurance and keeping you updated every step of the way. So if you have a request like that, bring it up to your care concierge and make sure you talk about that with your provider during your visit.
And one thing just to add to that is that many people think, oh, am I going to have another consultation with that in-person provider in order to get the Botox? And the answer in most cases is no, almost never for Botox, because the order is written by the Neura Health provider, and they at your that particular clinic or any clinic that you go to, they just come in and do the procedure with you. They don't have to have a whole nother consult in most cases, as long as we can order it directly for you. And then your care can continue to be overseen by a Neura Health provider, even if you frequently do go and get Botox at that local facility.
Throw your questions at us. We're happy to help.
Another question we get a lot, Kelly, is why is there a membership fee in addition to the medical visit fee? What is the reason that we charge that membership? Can you
Yeah, the membership fee is it. We have some awesome benefits here at Neura. The membership fee really helps us to make sure that we're running smoothly, right? We're an online platform. So your unlimited chat, your care concierge, your 2 care coaching sessions, and really access to the provider calendar to give you those appointments within a week or less, which is super cool. That membership fee helps us make sure that those benefits, keep running smoothly, and that we're always updating our product, and that we're connecting you quickly with providers and helping you in a seamless fashion. So while that's not maybe standard for a lot of healthcare, our membership fee really offers you a lot of great benefits that you would not find at a brick and mortar. So that's why if you write to us at info@neurahealth.co, we'll give you that special code, and you can try Neura for $1. So there'll be no membership fee for the first 5 weeks. So you can give us a test drive for $1.
The next question, Kelly, is do you have same-day appointments?
I wish we had same-day appointments. Unfortunately, we do not offer same-day appointments, but a lot of times someone will call and they're excited to try Neura, and we can see that there's a next day appointment. So sometimes we can get you in within a couple days. We say a week, but for some conditions, we can get you seen within a couple days. It's very rarely we can do a same-day appointment. We'd have to do a lot of juggling, and we don't have visibility on same day. So unfortunately, at this time, we don't offer same day, but next day.
And one thing
It
to point out
also,
on that is the average wait time to see a neurologist in the US is 4 to 6 months. So
Right.
even within a day or two, or even a week, is a huge improvement over what is probably your other option, which is going to a local neurologist that makes you wait a lot longer.
Yeah. And I do want to say too, when you pay that $1 to start your trial, you have access to all those membership benefits, the calendar, the chat, your concierge, and booking those care coaching sessions. So it isn't like you have to wait to use our membership benefits. You can start to really see how Neura can benefit you very quickly so that you can get connected for care right away.
Any other questions?
All right, well, if that's going to do it for today, listen, everyone, I'm really glad you got to be here today and learn more about Neura Health. Don't forget to email us at info@neurahealth.co. And I'm so thrilled that you got to meet Trevor today and understand how a 45-minute video visit works. Keep in touch with us. You can find us in the chat. You can call us at 201-275-1141, and we'd be happy to speak to you. I hope you have a great day, everybody, and thanks for joining us today for our office hours. Bye.